10 seconds may reveal more about your balance than you expect. Not while walking, not while climbing stairs, simply while standing still. Place one foot directly in front of the other, as though you were standing on a narrow line. Then try to hold that position for 10 seconds. It sounds easy, but after 60, this simple position can reveal how well your feet, legs, eyes, inner ear, and brain are working together to keep you upright. Before you try it, there is one important safety rule. Do not perform this test alone if you already feel unsteady, use a walking aid, have fallen recently, or have been told that standing balance is unsafe for you. Stand beside a stable kitchen counter. Ask another person to stay close. Keep your eyes open, and stop immediately if you feel dizzy, weak, painful, or unsafe. Do not use a lightweight chair that could slide away. Now begin with your feet side by side. If that feels steady, place the instep of one foot beside the big toe of the other. Then move one foot slightly farther forward. The final position places one foot directly in front of the other, with the heel touching the toes. This is called a tandem stand. Try to hold the position for up to 10 seconds without moving your feet or grabbing for support. Can you hold it? Do you begin swaying? Do you need to step away? Or does one side feel much less stable than the other? Not holding the full tandem position for 10 seconds may suggest an increased risk of falling. But this is important. The test does not diagnose the cause. It is only a simple balance screen. A person may struggle because of leg weakness, poor vision, medication effects, foot problems, dizziness, reduced sensation, or another health condition. In this video, we will explain what the result may mean, which quiet warning signs often appear before a fall, and what can genuinely help improve safety and confidence after 60. Because preventing a fall does not begin after you hit the ground. It begins when you notice the small signs that your balance is changing. Holding the tandem position for 10 seconds does not prove that your balance is perfect, and losing the position does not mean that a fall is certain. What the test does is challenge several systems at the same time. Your feet must sense the floor. Your ankles and legs must make small corrections. Your eyes must help you understand where your body is in space. And your inner ear must help detect movement. When these systems work well together, standing still feels easier. When one or more systems are weaker, you may sway, step out, or reach for support. That result is useful because it gives you a clue. It may suggest that your balance deserves closer attention. But the number itself is not the whole story. Notice how you perform the test. Did one side feel harder? Did your ankles shake? Did you lean heavily toward the counter? Did you feel dizzy? Did you hold your breath? These details matter. A person may hold the position for 10 seconds but still look extremely unstable. Another person may lose the position because of foot pain, poor footwear, or fear. That is why this test should never be treated as a diagnosis. It is better understood as a simple screen, a sign that may help you decide whether to look more closely at strength, vision, medication effects, dizziness, sensation in the feet, or another factor affecting balance. The safest question is not, did I pass or fail? It is, what did my body reveal while I was trying? Balance usually changes quietly. Most people do not suddenly wake up unable to stand steadily. Instead, several small changes begin adding up. Leg strength may decline. The ankles may become less responsive. Vision may become less reliable in dim light. Sensation in the feet may become weaker, and the inner ear may become less precise at detecting motion and position. The brain then has to work harder to combine all of that information. This is one reason balance may feel worse when you are tired, in a dark room, walking on an uneven surface, or turning quickly. Medications can also play a role. So can dehydration, low blood pressure when standing up, joint pain, diabetes, and reduced activity over time. That is why balance is never just about one body part. It is a full body coordination task. And when one part becomes less efficient, the rest of the system has to compensate. At first, you may not notice much. You may simply feel slower when turning, less steady when standing on one leg to get dressed, or more careful when stepping off a curb. Those small changes matter. They are often the quiet signs that balance is becoming less automatic than it used to be. The balance test is only one clue. Daily life often reveals even more. Pay attention if you have started using walls or furniture for support. Notice if you hesitate before stepping off a curb, or if turning around quickly makes you feel unsteady. You may also feel less confident in the shower, on stairs, or when walking in low light. Another sign is changing the way you move, taking shorter steps, walking more slowly, keeping your feet farther apart, or avoiding places where the ground is uneven. These adjustments may feel sensible, but they can also show that your body is quietly compensating. The most important sign is not one awkward moment. It is a pattern. If balance feels less automatic than it used to, that change deserves attention. A fall is not always caused by one major problem. Often, it happens when several small risks meet at the same moment. A weak leg, a loose rug, poor lighting, a quick turn, a medication that causes dizziness, or a brief loss of concentration. Individually, each factor may seem minor. Together, they can make recovery much harder. After 60, the body may react more slowly when balance is lost. The legs may not generate enough force to correct the movement. The hands may not reach support in time. And fear after one fall can lead to less activity. That creates another problem. Less movement can reduce strength, confidence, and balance even further. This is why fall prevention is not only about avoiding injury. It is also about protecting independence. The goal is to notice risk early, before one unstable moment begins changing the way you live. Balance changes should be evaluated when they become frequent, worsen over time, or begin affecting daily activities. Schedule an assessment if you often reach for walls, avoid stairs, feel unsteady when turning, or have fallen more than once. Also mention dizziness, numbness in the feet, vision changes, weakness, or symptoms that began after a medication change. Seek urgent medical attention when balance changes suddenly, especially if they appear with facial drooping, weakness on one side, difficulty speaking, severe headache, chest pain, fainting, or sudden vision loss. Those symptoms may involve more than ordinary balance decline. A qualified healthcare professional can review strength, walking, vision, medications, blood pressure, sensation, and other possible causes. The goal is not to wait until another fall happens. It is to understand why balance is changing while there is still time to act. The good news is that balance can often be supported. The first step is identifying what is making you less steady. For some people, the main issue is leg weakness. For others, it may be vision, footwear, dizziness, medication effects, or hazards inside the home. Strength and balance exercises can help the body respond more effectively when stability changes. This may include supervised chair rises, heel raises, gentle strength training, Tai Chi, or balance exercises chosen for your ability. Do not begin with difficult one-leg exercises if you already feel unsafe. Start beside stable support and ask a qualified professional which exercises are appropriate for you. Daily movement matters too. Regular walking and safe activity help preserve strength, coordination, and confidence. Avoiding movement completely because of fear can make balance worse over time. Your home environment also matters. Improve lighting near stairs and hallways. Remove loose rugs and clutter. Use secure handrails. Keep frequently used objects within easy reach. Wear supportive shoes that fit properly, including inside the home when needed. Have your vision checked regularly. And ask a healthcare professional or pharmacist to review medicines that may cause dizziness, sleepiness, blurred vision, or low blood pressure. Do not stop medication on your own. Fall prevention rarely depends on one dramatic solution. It usually comes from several practical changes working together. Stronger legs, safer surroundings, better vision, appropriate footwear, a medication review, and the confidence to keep moving safely. The goal is not perfect balance. It is giving your body more ways to recover before a small loss of stability becomes a fall. The 10-second tandem stand can reveal something useful. Not whether you are guaranteed to fall, but whether your balance may deserve closer attention. If you sway, step out, grab support, or feel much less stable on one side, do not treat the result as a failure. Treat it as information. Balance can be affected by strength, vision, medications, blood pressure, dizziness, foot sensation, pain, and the environment around you. That is why one test never tells the whole story. Pay attention to the patterns in daily life. Using walls for support. Feeling uncertain on stairs. Taking shorter steps. Avoiding uneven ground, or losing confidence when turning. These small signs matter. The earlier you notice them, the sooner you can take practical steps to protect your safety and independence. This video is for educational purposes only. It does not provide a diagnosis and does not replace personalized medical advice, examination, or treatment from a qualified healthcare professional. Do not perform this balance test alone if you already feel unsteady, use a walking aid, have fallen recently, or have been told that standing balance is unsafe for you. Stop immediately if you feel dizzy, weak, painful, or unsafe. If balance changes suddenly or appear with weakness, facial drooping, difficulty speaking, severe headache, fainting, chest pain, or sudden vision loss, seek urgent medical attention. If this video helped you, subscribe to Silent Health Triggers. Here, we explain the quiet changes that can affect life after 60, without fear, exaggeration, or miracle promises. And tell us in the comments, could you hold the tandem position for 10 seconds? Your experience may help someone else recognize the same quiet warning sign. Stay active, stay aware, and we'll see you in the next video.